Hey, and welcome to a new Talk About It Thursday video. I want to use today's video to discuss lupus, which is a chronic health disease that affects many people, and to give you all 5 uncommon facts about the disease. Lupus is a chronic, often long-term disease that can cause inflammation and pain in any part of the body. It is an autoimmune disease, which means that the body's immune system, or the body system that usually fights off infection, goes in and attacks healthy tissue instead. Here are 5 facts that you may not know about lupus. The first fact is this: lupus symptoms often vary from person to person, and the severity of these symptoms and the body parts that are affected also vary. So some of the most common signs of lupus are a rash, often known as the butterfly rash, a joint pain, and it can also include fatigue, hair loss, mouth sores, and fever. Second, lupus is known as the great imitator. Lupus shares many of the same symptoms as other conditions like rheumatoid arthritis, fibromyalgia, and Lyme disease, and so that's why it's often called the great imitator. Because there is no specific blood test pointing to lupus or these other autoimmune conditions, it can sometimes take a lot of trial and error for rheumatologists and doctors in general to pinpoint the correct diagnosis. Third, race plays a huge factor in the diagnosis of lupus. So lupus is about 2 to 3 times more common in African Americans than in white Americans. And additionally, Asian, Hispanic, and Native American populations are more likely to develop lupus. And the most severe forms of lupus are often seen in African Americans and Hispanics. Fourth, women are the most at risk for diagnosis of lupus. Current studies are showing that about 90% of individuals with lupus, or about 9 out of 10 people diagnosed with lupus, are women. And those who are diagnosed are often diagnosed in their 20s and 30s. Lastly, certain drugs or medications can cause lupus, and this is known as drug-induced lupus. So here are a few common medications that have been known to cause lupus when taken. The first, isoniazid, which is used to treat and prevent tuberculosis. Second, hydralazine, which is a high blood pressure medication. And lastly, procainamide, which is used for cardiac arrhythmias. So the symptoms of drug-induced lupus include low-grade fever, aching and swelling joints. Luckily for drug-induced lupus, it's often considered not a chronic disease, as once the medications are stopped, the symptoms go away. Do you know somebody with lupus and they want to be in research? Well, feel free to contact us. You can do so by reaching out by phone at our regular office number or at our 24-hour line number, or you can reach us online through our website or one of our social media pages. All right, everyone, have a great Thursday, and I'll see you all next Thursday. Bye.